Hey everybody, this is Dr. Glenn with the Carroll Institute, and today we're going to start talking about labs for thyroid, and this is a big topic for a lot of people. I'm going to show you which labs you need to have run and give you a list of things that you need to look at. So if you want to get your doctor to run those for you, you'll know exactly what to ask for. All right, so let's talk about labs here for just a second. And what I've got here is a bell-shaped curve, and this would represent, let's say, T.S.A, thyroid stimulating hormone. Now, the way we look at things in functional medicine is like this. The traditional range is way out here from like 0.5 all the way up anywhere to like 5.5. And we say that's way too wide. So what we want is we want to see your numbers right in here, right under the good spot of this curve. And we call that good health. So let's take an example. This is a patient that came to me, and she'd been on thyroid replacement hormone, centroid, for many, many years. And her doctor kept telling her, oh, you're looking fine, everything's doing just okay. And all he was ever measuring was her TSH. And if you look at that TSH number right there, you'd say, that looks great to me. Well, here was the problem. When we ran the rest of her thyroid panel, look, every single marker except for TSH was out of range. This poor woman, not only was she not making enough T4, but she was also not converting it into T3. Remember that liver and the intestine, they convert T4 into T3 so that you can use it. And this person here, she had elevated thyroid peroxidase antibodies and elevated thyroglobulin antibodies. This woman had Hashimoto's, so she has an autoimmune disease against her own thyroid, and you cannot treat that by taking Centroid. Here are three different patients. This one has a low TSH. You see TSH right there, and this one's low. This one has a normal TSH, and this one has an elevated TSH. Three completely different TSH values. All three of them have low T3. You cannot use TSH as a reliable marker for measuring thyroid function. All of these people have low conversion and their TSH is all over the map. So here's my question to you. You got a little helicopter model here. There's 10 pieces. I just chose this because there are 10 different markers in the thyroid panel that I run for patients. Now, you've got to get into this helicopter and go someplace. I want to know which pieces are you going to leave out. If you've got to get into the helicopter and fly, which pieces are you going to leave on the runway? Yeah, I didn't think so. I wouldn't leave any pieces on the runway. I want to know all the markers. This is Dr. Glenn with the Carroll Institute, and you have a great day. Bye.